Hello everyone. I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be speaking about how to manage diarrhea in cancer patients. Now, diarrhea is meant by the passing of the loose stools at least more than 3 times in a day. Generally, this symptom or side effect is seen amongst the cancer patients who are undergoing a chemotherapy or a radiation treatment or post surgery, and especially it is seen in the patients who have gastric related cancers. It is also very important to manage diarrhea in such patients because it can also lead to again malnourishment, or it can alter the nutritional status of the patient as well. What are the other causes of diarrhea in these patients? So, because of certain drugs or medications which can alter the gut microbiome, or it could be because of also a food sensitivity towards a food which they are having, or even it could be because of the food intolerance. Now, the patients who undergo various cancer related treatments, they also have an altered gut health. Why this is because generally when they undergo any sort of a treatment, it is also going to cause some amount of a irritation to the gut lining, due to which it is also going to alter their gut health and put them at a risk of gastric discomfort. It could be even bloating or constipation or even diarrhea as well. So it is very important in understanding what is the approach and how we should give the approach towards this. Now, if you ask me which fiber is beneficial for these patients who have diarrhea, I would say it is soluble fiber. Now, what is that property in a soluble fiber which is going to make it beneficial in helping to reduce the diarrheal episodes in these patients? In my earlier videos, I had also spoken that soluble fiber has a property of forming a gel-like substance which is going to also help in bulking the stools as well. Now, in diarrheal patients, how it is going to be beneficial is that when we consume soluble fiber, it is going to absorb the excess of the water which is there in the small intestine, and it will also form a gel like substance which will help slow down the bowel movements. Now, this will again add bulk to the stools and make it less watery. Now, sometimes when we are taking a nutritional assessment of the patient or even a follow up, it's very important to understand what is the formation of stools, like if they are having diarrhea. It could again be very watery stools, it can also be even semi solid stools as well. Now, we generally tend to follow what is called as a Bristol stool chart. A Bristol stool chart has a scale from 1 to 7, which will give us a clear understanding of what stool formation is the patient having, so that it can also help us to modify the diet accordingly. So now let us go ahead and understand what are some of the important tips which we need to keep in mind, especially when it comes to the diet as well. First, importantly, it is very essential to stay well hydrated. At least drink 1 to 2 liters of water in a day, which is also going to help in staying well hydrated. Because of diarrhea, a patient can also have loss of water or other fluids in the body, which can also put them at a risk for dehydration as well. However, we need to ensure that we reduce this dehydration. So you can also incorporate in the diet water and other liquids like lemon water, or even you can include buttermilk, which is a good probiotic as well. However, we need to ensure to avoid sugar-based drinks or beverages which could again aggravate the condition also. Ensure to incorporate or consume small frequent meals in a day so that it can also help to reduce weakness in the body. Now, traditionally, the doctors tend to follow a BRAT diet. Now, what is meant by a BRAT diet? The full form of BRAT is B stands for bread and R stands for rice. A stands for applesauce and T stands for toast. So these are the low fiber foods which can be incorporated into the diet because they have the property of soluble fiber which is going to help in bulking up the stools as well. Now, most importantly, it is also important to understand that what are the foods to include and what are the foods to avoid during such a condition. Now, you can include foods like rice or rice-based noodles, bananas, apple sauce. All the vegetables which are incorporated need to be well cooked or pureed. Nothing should be given in the raw form as well. Yes, during this time, white bread also can be given. Now, what are those foods which need to be avoided? Raw vegetables and fruit need to be avoided. High fiber vegetables like corn or cabbage, cauliflower needs to be avoided. Strong flavored, spicy food, fatty food, or even for that matter, alcoholic beverages or caffeine containing beverages needs to be restricted during this time. So, to conclude, yes, managing diarrhea in cancer patients is extremely important. One, we do not want them to experience dehydration. We want that their body is well replenished with the fluid losses as well, and we also need to help them manage the side effects or the symptoms. Thank you so much for watching my video. We at ZenOnco.io are here to navigate you throughout your journey. In case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.